Welcome to the most authoritative hour on TV. It's The Pulse. We're live from our studios in Kokomlemle on your digital terrestrial TV because we're free to air on DSTV channel 421 and Go TV channel 144. Remember, we are your home of independent, fearless, credible, and impactful journalism. This afternoon, a strong warning to avoid the consumption of poultry and poultry products if you can. This is coming from the head of National Food and Safety Laboratory for Animal Health, and following the outbreak of the deadly avian influenza, also known as bird flu, in parts of the country. We'll hear from Dr. Kikimoto on how the authorities are launching investigations to establish how the disease was imported into the country.
What's happening currently is that, you know, the birds they sell there, they are layers, old layers. So sometimes you may be surprised that some of the birds were taken before the outbreak.
Also this afternoon, the country's top medical experts are in the Ashanti region capital, Kumasi, as they seek solution to the fast rise in COVID-19 cases, which experts say is being fueled by the Indian Delta variant. We have our camera lenses widely open with live updates from the crunch meeting, plus the country's current situation on COVID-19. Meanwhile, Health Minister Kwekwajuman Meno has been explaining how frustration led him not to seek parliamentary approval for a COVID vaccine contract with Sheikh Al Maktoum in breach of the constitution, saying it's because Ghanaians were dying. We are live in Parliament to bring you all the happenings from the parliamentary sitting probing the contract, plus other events in Parliament. The Pulse is brought to you by Global Communities, Dignilu, Affordable Safe Sanitation. My name is Aisha Ibrahim. Remember, we're also streaming live on YouTube and all our social media handles. Tweet at us with the hashtag The Pulse. My personal handle is @TheNanaAisha. Always a pleasure to host you. I'm grateful that you chose us. Let's begin with the warning coming from the Agric Ministry. Avoid the consumption of poultry and poultry products if you can. That's a warning from the head of National Food and Safety Laboratory for Animal Health at the Veterinary Services Directorate, Dr. Bashiru Boy Kikimoto, following the outbreak of the deadly avian influenza, also known as bird flu, in parts of the country. More than 10,000 birds across 3 regions, Accra, Central, and Volta, have either died naturally or have been put to death following the outbreak. We'll hear from Dr. Kikimoto shortly, but first, my colleague Faustina Safo has been engaging some poultry traders at some markets in the capital. Some of them claim they have not spotted symptoms of the disease yet on their birds.
The Ministry of Food and Agriculture has confirmed the outbreak of bird flu in the Greater Accra, Central and Volta region. It says so far 6,000 birds have died naturally and 4,500 have had to be killed as part of measures to control the spread of the disease. It also estimates about 600,000 farm animals could be affected, and so as part of measures to curtail the spread, they have banned importation of poultry from Nigeria and Togo. Also, if you stay in other regions that have not recorded cases, you would not be receiving poultry products from the Greater Accra, Central and Volta region. Now, we're currently at Malata Market to talk to some of the individuals who actually deal in the buying and selling of poultry. And we've been speaking to Abdul Karim Tazan, who happens to manage one of the biggest corners here in the Malata Market. What's the bird flu? What is Asem no?
JoyNews, I told them there. Who say you're an ambassador? Could be a coffin coconina, you're an who's a bank coconina, and Kawaha, who say you're going to abuse. I'm not Dr. Fonny Bukurabaha. I must say, I am Biana, I am want to idea.
Doctors no for buy, dear Namukai.
I'm a say, I don't know. I've been here.
We heard it in the news that some birds in the country have been infected, but we've not spotted any symptoms of the disease in our birds. Officials from the Agri Ministry even came around to inspect our birds and confirmed they are healthy.
Inti sesi enkrofo moto enam no.
Omoto. Because I know you have been Miss Romoto, but you almost a Romoto.
So far, sales have been good. Customers still buy from us, even though they fear some of the birds may be infected.
My next stop is at Nima Market, still in the Greater Accra region, and we're here to also speak to those involved in the sales of poultry. We'll go inside. We've been given quite a description of where the place is. We're hoping to move inside and then speak to some of them. Me pacho painful me chow. Me pacho frozen.
For me sumo.
Brasmo. Me sesi ano musi yarebia ba watin nkade.
Debe denti. Ebi akofa kwara ya hunu bida. Akofa tare jine kofa mba ya hunu ensia yare ne bida ho. Yanko no nyina flesh. Ya muno mo yare. Omutia pok. Omu jina mo nanso.
Our birds are healthy. None of them have been infected. In fact, we don't mix the sick birds with the healthy ones. We keep them separately to ensure they don't infect the healthy birds.
Toba no yare a yan fan fra we no. O de fra we no omunum nsuo boma. Sa yare nso banya omo. Nti aba de no hu ton na se wa mere na yayi na sifo.
The bird flu ni di ampade ebam ba yan hu ebi wa symptoms ni wa ase. Anka yan hu bia anka e be kire mu sample. And sometimes the weather we no yeah, do move for enough, but I weather and assistant. And sometimes I encounter problems, but yet say one symptoms of bird flu. Young who I see. And a portrait the young farms maybe. You're tired there from market to market. And to say who symptoms I was bird flu number. But yeah, call your quite catchy agbozono north tamale bolga. Wa no way na ye hu bi ba say e won say doctors o mu si ebi wo ho dia yentimi nchele njo mu ba ni ma say ye hu bi da.
It is true that bird flu is in the country, but we have not spotted any symptom of the disease on our birds. We don't even buy from poultry farmers. We bring our birds from as far as Akachi, Tamale, Wa and Bolga, and in all these places they have not detected the disease yet. We can even cook some for you to eat. If you happen to fall sick, you can arrest us.
So, baby, no bechi.
So he's confirming that here at Nima, they have not recorded any case of bird flu. He's even confident to say that, peradventure we want to try any of the birds, he's willing to cook one for us right here. I'm Faustina Safo reporting from Nima Market.
Let's now hear from Dr. Bashir Boykikimoto, who reveals that authorities have launched investigations to establish how the disease was imported into the country. He spoke to Mama Viusa Boaji on the AM show this morning.
What is happening currently is that, you know, the birds they sell there, they are layers, old layers. So sometimes you may be surprised that some of the birds were taken before the outbreak. But I advise that it is even not advisable now. It's better we all just sacrifice for the meantime until the situation is under control, until we get the news from the Director of Veterinary Services that now they feel that it's safe to go to any market, to anywhere and buy, because you don't know the source. You know, Ghanaians sometimes, they sneak things in the night. You will not be sure. So to make sure that you are safe, just like how you and me, we are covering ourselves because we don't have corona. I mean, if corona has been there for almost 2 years and you're doing all this, covering your beautiful face like this for 2 years, why can't you just be hungry for 1 month? I get what I'm saying.
I get it.
So we should just sacrifice a little. It's better.
Okay. So don't go buying chicken.
It's no good. For the meantime, it's better we just avoid it.
So how about the frozen ones?
The frozen ones, unfortunately, some of them are not from Ghana. And that's why the veterinary services is very particular about importation. That is because now that there's an outbreak in Ghana, it's the World Organization for Animal Health, which is going to put this one in their headquarters in Paris and tell every country in the world that Ghana now has outbreak of avian influenza. So don't import chicken from Ghana. That's what they will tell the whole world. So that is why if you want to bring in even chicken to Ghana, you come to veterinary services first, so that we will tell you that you can only get permit from here because the OIE that is controlling all animal diseases has told us that you can't get chicken from Kazakhstan, you can't get it from Russia, you cannot get it from Poland. You see, that is why our importance is the importance of vet, even at the ports, is very important to prevent this kind of entry of diseases. So I think that when we do things like that, then the country will be...
From animals to humans, Kwekwaja Mameno has defended his decision, by the way, his Minister for Health, not to seek parliamentary approval for a COVID vaccine contract with Sheikh Al Maktoum in breach of the Constitution, saying it's because Ghanaians were dying. He says he was desperate to get vaccines and was frustrated because regular vaccine supply sources had failed. He's been responding to questions at the sitting of the parliamentary committee probing the contract.
Did you seek parliamentary approval before you entered into this contract?
No, please.
You did not.
Have you any such plans? I thought she was going to have a follow-up question. I had plans to come to regularize the parliamentary approval, to seek for parliamentary approval after I've signed the contract.
Do you appreciate the fact that the pronouncement by the Supreme Court vis-a-vis the constitutional provision clearly talks about prior approval? You appreciate that?
Madam Chair, very much so. But my frustrations to try to get a vaccine for us at the heat of our second wave, I relied on the Executive Instrument 61 that was passed by Parliament to hide behind emergency clauses that have been invoked, to try to see if I could do that and come to Parliament to inform Parliament that this is what I've done and therefore need regularization, I need approval to cover it. Because we were in dire need of the vaccines, and I had the onus to try to procure the vaccines to vaccinate Ghanaians to protect our lives.
But the EI is subsidiary legislation.
Honorable Chair, I must be very honest with you. At the time, I've mentioned my frustration was the fact that I seriously made that error, and on hindsight, it won't happen any longer.
Mr. Minister, you are a senior member of this House, and you are aware of how we deal with emergency situations in Parliament. We have conventions and rules and regulations governing how you deal with emergency issues, i.e. appearing before the relevant committee and make a case so that the issue can be dealt with as an emergency issue. Why didn't you take advantage of that procedure?
Madam Chair, I've explained that those were not normal times. And I was seriously in the situation that couldn't make me think properly, the way you think that now I will actually address myself to the situation.
Mr. Minister, are you aware that we have dealt with issues and motions on the same day before on the floor of the House, in this House? And let me give you examples. You remember the $1.2 billion and the $100 million from the World Bank? We dealt with it the same day. Couldn't you have done that?
I could have done that, but the circumstances at the time was a little bit different.
Honorable Minister, you have laid evidence before this committee that you used your best efforts to get diplomatic channels to enable you reach the manufacturer or the Russian authority directly. Is that correct?
Yes.
You even did so by producing letters as evidence of such correspondence. Is that correct?
That's correct.
You further indicated that it was after all those best endeavors have proved futile before you dealt with the Sheikh. Is that correct?
That might not be correct. I dealt with the Sheikh before the frantic efforts to try to get the vaccines from the right source.
So, were you being untruthful to this committee when you indicated that you use your best efforts to get direct access to the manufacturer and the Russian authorities before you dealt with the sheikh?
I can't remember I have said this anyway. What I said was that I made efforts, but I didn't just oppose the timing of the efforts that I made.
Minister for Health Kwajima Menu says Ghana will pay Sheikh Maktoum for 20,000 doses of Sputnik V vaccines delivered to the country. This is despite his inability to deliver all 3.2 million doses of vaccines requested for in a contract with the government of Ghana, which he has since terminated. Parliamentary correspondent Joseph Opoku Gakpo joins me live from Parliament. Gakpo, let's begin with the reaction. He says the 20,000 doses delivered earlier. And what else can you tell us about what the minister has been saying?
So there were specific questions to him on how much government is likely to pay as far as this particular contract is concerned. And he explained that despite the initial contract, they requested that Sheikh Maktoum brings in some doses as evidence that they will be able to deliver on the contract. Initially, he brought in 15,000 doses when it comes to the first dose, because then the first dose of the said vaccine is different from the second dose. The first batch that came in was actually 10,000 of the first dose and 5,000 of the second dose. So then government requested that he brings in the extra 5,000 of the second dose, so that then there are 10,000 of the first dose and another 10,000 of the second dose. Mr. Ajman Menu has been explaining that that initial 20,000 doses that were brought in is been administered to key public sector officials, including those who stepped out recently to do the census and other frontline healthcare officials, because then they needed to be vaccinated one way or the other before they step out on some of those very critical assignments. And so that was done. Although the terms of the contract had been breached, those 20,000 doses that were brought in have actually been administered. Ghana has made use of them. And so after the Sheikh indicated on the 14th of July that the contract has to be terminated, and went ahead to write to government and indicate that it has terminated the contract, well, a conversation will subsequently begin on how much they may have to be paid for the first 20,000 doses. And then government may then go ahead and fulfill those obligations. But he makes the point that that is still a conversation that's outstanding, that's not gone ahead yet. So they're waiting for those times to come for the negotiations to be done. But he confirmed that although the contract didn't have parliamentary approval, although the Sheikh did not meet the terms of the contract by supplying all the 3 million doses plus, they will still have to be paid for the 20,000 doses that have been delivered earlier.
What has been the reaction from the minority?
All they've done is actually ask questions, as they insist that this particular conversation has all been about. It's just been a probing section as far as the MPs on the minority side are concerned. Kwabna Mintakando, who is the ranking member on the committee, kept going back and forth with the minister, seeking clarity on what exactly government's position is as far as the termination of the contract is concerned. Not just that, Elizabeth Ofuswajare, another minority MP on the committee, has also been raising questions about government obligations and what all of this will mean. And she has placed a lot of focus on the role of the Attorney General in all of this, because then what happened was that the Attorney General actually communicated to the Minister of Health in a letter indicating that there is the need to seek the necessary parliamentary approval for this particular contract. But the minister explains that it got to a point when he was very much clear in his mind that this contract was not going anywhere because the Sheikh in question had repeatedly failed to meet the obligations of the contract. And so he didn't find it necessary to go ahead and seek parliamentary approval for a contract that the Sheikh would not be able to deliver on eventually, which was how come he hadn't gone ahead and brought the document to Parliament for the necessary approval. But initially, because he was frustrated, because Ghanaians were dying from COVID-19, and because he was desperate to bring in vaccines for the populace. That's how come he went ahead with the contract without the necessary parliamentary approval. But subsequently, he was hoping to regularize the contract, but things, it eventually became not necessary because then the contract in question had been cancelled. And so the minority MPs are obviously not happy with the payments that may have to be done to the sheikh in question, but they're hoping to put out all of those details when eventually they publish the reports of the committee on this particular investigation. Aisha.
Plans for vaccines? Did the minister...
Aisha, I missed that.
Yeah.
If you could repeat your question again.
I'm asking about alternative plans for vaccines, if the minister hinted on that.
He spoke about that on Thursday when he first appeared before the committee and indicated that there is work that's ongoing with the COVAX facility to bring in some vaccines into the country. He made the point that as early next month or late next month, about 1.2 million doses of the Johnson & Johnson vaccines are expected in the country from the American government, again through the COVAX facility. He again explained that even beyond the donations that are expected, work is ongoing to ensure that government actually buys some of the vaccine doses separately from some of these manufacturers. So he says, despite the development in question with the termination of the contract with regards to the Sputnik vaccines, efforts are ongoing and expectations are high that some vaccines will come in through the COVAX facility.
So what's next for this probe? Is it over now? And when do we expect the committee to present a report to the House?
Well, it's not over yet. The health minister is expected back before the committee on Wednesday because there are a number of other outstanding issues, including claims that he allegedly deceived the House about the prices of the Duxin, which is like the 7th item that the committee is probing. They've not got into those specific details yet. Earlier today, a number of other officials, apart from the health minister himself, did testify before the committee today. We had, among others, the head of legal services at the Ministry of Health appearing before the committee, Umwa Yusuf. He's the director of legal services at the health ministry. Not just him, Tete Kofi Romeo, who is director of supply chain at the health ministry, also appeared before the committee and was sworn in to respond to some questions. And Komla Bedu Afare, who is chief director at the ministry, also appeared before the committee to respond to questions. There were a number of other disclosures, including a disclosure that not even cabinet approved this particular contract before government went ahead and signed this particular contract. And it's one of the things that the minority MPs said that they were not very much excited about. We're expecting that Wednesday there will be further questions on that to the health minister. And additionally, there was a disclosure from the health minister that when you look at the $19 price for the Sputnik vaccines, as far as the contract with Sheikh Maktoum is concerned, it actually included other provisions, including transportation, as well as issues having to do with storage and injections that will be used in getting out these vaccines. So then he made the point that he was very much aware that the ex-factory price is actually $10.5, but all these other incidentals fed into the decision to agree on the $19 price. And so all these other aspects, as well as interrogation of other officials apart from the health minister, that's expected on Wednesday when the committee resumes sitting. And the committee has up until next week, Friday, to actually deliver its report. We wait to see whether by then they will be ready with their report or they may request for a possible extension of their work so that then they would have more time to actually probe this particular issue. But the expectation is that most likely sometime this week they would go ahead and complete the public hearings, and then they would go ahead and write their report sometime next week and submit the report to the plenary of Parliament before the House takes its break, which is expected sometime in the first week of August.
Joseph Opoku-Gakpo, he's our man in Parliament. He brings us updates of all the happenings in that House. We'll do more on COVID-19 as we look at the alarming cases being reported at health facilities. We'll make a stop in the Ashanti region for that crunch meeting being held by health officials. Stay with me. I'm coming right back. Welcome back to the Pulse this afternoon. The country's top medical experts are in the Ashanti region capital as they seek a solution to the fast rising COVID-19 cases. The country's active cases have increased substantially over the last few weeks. Our focus this afternoon is on the situation in the regions because the Ghana Medical Association is warning that intensive care units in across major hospitals are being overstretched as a result of the rising COVID-19 cases. We start by looking at the current case counts, and right there on your screens, you will see that the new cases are rising to 382. That's the new cases we have. Active cases now 2,858. Confirmed cases 98,817. Recoveries 95,147. Deaths have now risen to 812. Let's look at the regional breakdown, and in there you can see the red spots in that map over there for you. You have the highest cases coming from the Greater Accra region, which is 54,115. The Ashanti region has 16,889. Western region has 5,984. Eastern region 4,559. Central region 3,552. Volta region 2,664. In the northern region, you have 1,661. Bono region 1,494. Bono East 1,467. In the Upper East region 1,321. Western North region 935. Ahafo region 847. Upper West region 500, Oti region 467, Northeast region 231, and Savannah region 132. So it's clear that Greater Accra, followed by the Ashanti region, are leading with the highest cases. Now let's start with the compliance in Kumasi, and my colleague Oheme Nteria will be telling us more on that one. Oheme, good afternoon to you.
Good afternoon, Aisha.
Yes, and of course, I'll also be joined by other health experts in this conversation. But before we even have this conversation, let's listen to some people in Kumasi complaining about compliance.
There's nothing I'm doing about the safety protocols. Me, for instance, the way the media were preaching about this coronavirus pandemic, nowadays I've not been hearing it. So me, I think it is gone for good, and there's no way it will come back. I heard the Ashanti region, we are leading. When you will see our attitude, the attitude of the people in the Ashanti region is very bad. Though it is not gone it is not gone. But the way, especially when you sit in the trotro and the taxi, people are not wearing their nose masks.
The Ashanti region, we are having a problem because of the political interference of the district. Because recently, when the St. John burial, and a lot of people are making a lot of comments that if the president will be making all the necessary about to wear the face mask and all this, and then they themselves during the funeral there is a lot of things happen there, and then because of that a lot of people, then you can't be communicate to some people who are not wearing it, because when you try to let them to use what you are doing, they are trying to refer you to the politician.
Coronavirus, me said them say, in said that you say coronavirus be never hand. Because here abrofun, I want coronavirus will start to fear by you. Here you see your mobile. When you pay good stadium, you did ye. Now here to Ghana the coronavirus be concluded. I mean, they say, and penny phone discadi. Oh, abrofun, no salary because here. We are not adhering to the protocols because we are tired of them.
Every day there's new virus. Every day there's new virus. We don't know what to do again. We are tired of them. They should come and kill all of us. We are tired of them.
And joining me via Zoom for more on this conversation. Ohim Interior is already on. Also on this is Dr. Parkway Sibedu, who is the Ashanti Regional Chair for the Ghana Medical Association. Plus on Zoom this afternoon, Dr. Samuel Kojo Amwakohene, who is an anesthesiologist, a COVID-19 ICU team leader at the ACHN Health Network Connecticut, and co-founder and president of the Global Partnerships Haloden LLC. Thanks so much, gentlemen, for your time. All right, let me start with you, Hemming. Why has it been difficult for people in the region to adhere to the protocol?
Aisha, a lot goes into why people are not adhering to the COVID-19 protocols. There's a lot of belief surrounding the COVID-19 in the region. Remember when the Ashanti region recorded the first cases in Obuasi, and later the disease spread to other parts of the region. Some municipal and district assemblies recorded some of these cases. People believe that COVID-19 is not even real. So even when there are people who thought that it is the figment of imagination of the politicians who have couched this whole idea to make money out of it. And that even when a hospital, is said to have reported COVID-19 case, there was this belief that the hospital or the facility will cash in, get a lot of funding from elsewhere, and then this will go a long way to also, help the managers of these facilities. So yes, people have their own beliefs and idiosyncrasies as far as COVID-19 is concerned. Then fast forward, the issue of John's funeral also came into play a very big role. People thought that yes, if you say this, big funeral where a lot of people should be agreed, not any other person than top government officials, the president, his vice, the chief justice, a lot of government, officials also came in and participated in this funeral to the point that other people were seen not in their face mask whilst in this community. So this has, made things difficult for people to adhere to the COVID-19 protocol. I must say the whole of yesterday, I was at the Kumasi Central Market area and then to the KGTR market and the Juso market, especially on a Sunday like this. It's a market day in Ejuso. And if you saw the number of people who were had gathered at the market and to see few people in their face mask, then it tells you that, yes, even those who were shouting and calling for people to attract the attention to their wares, none of them were in their nose mask. Just that a few of them, parents who had come from outside the community to patronize the market, a few of them were seen in their face mask. So yes, people have their own beliefs, thinking that after all, even if we die, then all die be die. As it has already been said somewhere, that yes, if the president and some top government officials come to the funeral, participate, even when we had a ban on funeral gathering and all that, and then they think that they have their liberty, they have the freedom to do whatever they want.
Okay, I think we're losing on him Interior there. We'll try and get him back, but he makes the point clear that people are just unwilling to put on their face mask, and some of them are now expressing fatigue. And that is why we're lucky to have Dr. Parkway Sibedu, and who is the Ashanti Regional Chair for the Ghana Medical Association. Doc, I'm grateful for your time. Thanks for all the good work you've been doing. We've been to the streets to look at the compliance level. There appear to be fatigue on the part of residents, and exactly what my colleague has been saying. What can we do differently?
Yeah, thank you for having us once again on your program. And yeah, though the population is fatigued, I don't think those of us with the Ghana Medical Association, we are as fatigued as them. And we'll continue to talk about COVID-19. And the reason being that when the cases goes up, it's the health workers who invariably will bear the consequences, because, you know, the patients are brought to us and you cannot run away from them. Yes, I think the sentiment has been summarized by Ohimin Tewia, our good friend. And from the interview you granted, even if you go to most of these state or private entities, I mean the banks, shops, and everything, as Ohime said, you can count on your fingertips the number of people who are complying with the COVID-19 protocols. The only places where people are made to adhere probably are the hospitals. And when you there raise the issue, you know, they tell you, oh, have you finished advising the politicians to come and advise us? And it's been the situation. As once again has been stated, funerals are going on as if nothing is happening. The last time, if my memory serves me right, and I stand to be corrected, I think there has been a ban on funerals, and I don't remember the president lifting the ban on funerals. But come to, you know, on Saturdays, in fact, Thursdays, Fridays, Saturdays, Sundays, come to Ashanti region. Things are going on as usual, and it's led by the politicians. We all know what has been going on. So to your question, what should be done differently? I think we should go back to where we were with insistence on the compliance with the COVID-19 protocol. But then the issue will be whether this government has that moral right and they have that moral fortitude to tell Ghanaians to observe COVID-19 protocols when they are the number one abusers of that. They disregard all these. And unfortunately, you have some of our colleagues in who are health personnel coming to tell you that COVID-19 is not spread at funerals, rather at parties. With this mentality, I doubt if they will have the moral fortitude to tell Ghanaians to go back. But I think that's what we have to do. Yes, mistakes were made and have been made, but I think it's not too late to tell Ghanaians that, look, we have to go back to basics. Come to our place, go to the hospitals. People are dying almost every day. And I always question the number of cases they are telling you. I mean, they put out as the death rates. And because of where we are, we get to know most of these. And so when people deny it, I go to places, and as Ohimi said, when you are a mask, you are seen as the odd one. And I always tell them, yes, I know where I'm coming from, and I've seen young ones, old ones die, and that is a big loss. So I think we should go back to basics. Thank you.
Right. So we've all agreed on the fact that people are not adhering to the protocols. That's number one. But what else could be accounting for the increase in numbers the surge in cases, especially in the Greater Accra and the Ashanti regions? Do you know?
Yes. I don't know whether, you know, when I got your call, I spoke with my colleagues from the public health unit to see whether we have been isolating the Delta variant. You know, each time the virus changes, you know, they become more virulent, more aggressive in order to survive. Yes, we want to eradicate the virus. We are getting vaccines in our shoulders, in the muscles, and all that. They also want to perpetuate their survival. So they will do anything to survive. And that means changing the way they behave. They become more aggressive. I don't have statistics to back it, but I'm tempted to believe that it might be the Delta variant. that probably is causing that, because you see, it's becoming more rampant, more infectious. And we've seen it. If you look at the data, you realize that between February and March this year, we had high incidence of cases. And that's when we were suspecting a new variant. And then the case load now begins to go down to its lowest ebb and then start increasing. So probably that could be accounting for that. And then secondly, the other contributing factors, as people reported in the interview, people think it's gone. And I mean, I've traveled around most towns in Ashanti region over the past couple of days, and you can once again count the number of people who are in mask. The funerals are going on, clubs are open. In fact, it's like there's nothing happening, you know. So those are factors contributing to this. People think it's gone. They want to see people dying from it. People, we're struggling to find burial places or finding ICU places before they will believe. They think, as the gentleman said, when I was in clinic this afternoon, somebody made the same comment. Oh, it's the disease of the white men. You only see it on TV, not in Ghana. I think these are some of the things fueling the rise.
And thankfully, we have Dr. Mwakohene on, who is part of this discussion, and he's going to help us do some comparative analysis. Dr. Mwakohene, let's do an assessment of the extent of risk that Ghana is exposed to.
Aisha, thanks for having me on the show. It's pretty eye-opening when you come to Ghana yourself, having been there for almost the month of June, and then sort of coming back to the United States, looking at where we are here in the United States and what Ghana is doing. I was just shocked when I was in the country. If there was ever a thing called COVID-19 protocols, obviously everyone is fatigued. Is globally. It's a problem that everyone has been having. And I think to answer your question, though, I don't see a brighter future in terms of how we're dealing with this pandemic in Ghana. And I say that on many different fronts. Number one, when you talk about the protocols that my panelists, the other panelists have sort of alluded to, it's difficult to find people really following them. So that's the first key indicator to go by. And then you look at, if you are not following the protocol, or even if you were following the protocol, what are your incidents in terms of COVID-19? And how much are you really isolating? What variants are you specifically dealing with? Are we sequencing these viruses or these sort of genomic sequencing? Are we up to speed? Do we know which variant is dominant within our communities? I had mentioned this about a month ago, and when the whole idea came about, patients with Delta variants have been isolated at the airports. And I made the assertion that early on during the pandemic in the US, when people were coming from Europe, we knew right there and then that the virus was already here. It was only a matter of time. And that's exactly what happened. If this virus has taught one thing, I'll tell you this: it moves very rapidly, and the Delta variant is highly transmissible. And so if you see it anywhere around your environment, you know you're already in trouble. So I think it's important to drive home the point that the risk Ghana is taking, it's a big risk because we're not following the protocols, and that's the reality on the ground. You just need to get out to the markets, to outside Accra, Kumasi, and you see what goes on. And so if you put that into perspective, then you ask yourself, what are we doing from the medical perspective? Are the hospitals ready to really take up these patients and treat them? Do we have the ICU capacity? And the last point I'll make is that in the US right now, when you come, most people are not wearing masks. But the reason is that we have about 45% of our population vaccinated. You can walk into a hospital, a CVS, and get a shot. Do we have that in Ghana? I mean, I think we've been hearing the story about for at least 2 months now that government is going to get some vaccines. And the question is, when is it going to come? Because in a situation where people find it difficult to wear the mask, albeit fatigue and the environment that we're in, the one option you have is to ensure that you can vaccinate as many of your population as much as possible so that perhaps you can reduce the rate of transmission and reduce the recurrence of these infectious new variants that you may not be able to control. And in fact, nobody globally is able to control COVID. The one thing we have is getting vaccines or shots in people's arms. And that, I don't believe in my own assessment that we've done enough of in terms of making sure that the citizenship is protected by getting shots into people's arms.
Dr. Bedu, there's the important conversation about resources and the fact that Ghana is lagging behind if it comes to health facilities and ICUs to fight this. Your association, the GMA, has over the period keeps reminding and warning the public that our ICUs may be filled up and we will be overwhelmed with the situation. I mean, let's talk about the management of cases right now. Are we overwhelmed?
No, so just a couple of days ago, you heard leaders who are mining the national, the case load leaders, okay, Dr. Owu, and all of them coming out to tell you that, look, we are running out of oxygen. We are running out of ICU bed. And in a day or two, that statement was counted by the Director General of Ghana Health Service, indicating that, oh, no, it's not true. Ghana has a lot of ICU beds and oxygen. I think that statement is in the public domain. You see, until we stop playing such politics, this is what we'll see. Come to the various health facilities, even without COVID, even before we got the first case of COVID, how well resourced were our facilities? We all know people complain of bed space, lack of proper treatment and all that. That is how the state of the Ghana the economy, the health services. And this COVID coming in, demanding more resources, has placed so much stress on the already stressed health system. Okay, so we don't have the resources, and I tend to believe what my colleagues who are seeing these patients on a daily basis. Well, I don't see the benefits of our colleagues who are in the treatment centers lying to Ghanaians. Why they have spaces available, I don't think they will come on air or make it public that we don't have those spaces. So I will go with what those leaders who are leading in the management are saying and not what the politicians are saying. You see, when we should stop playing politics with these, okay, and let the citizenry know the situation, that already our health sector is on its knees. We don't have basic things. Come to the hospitals, come to Kumasi, come to Konfanoche Hospital, come to the emergency units. You see people sitting on benches. That is the situation for you. So if you have 30, 40, 50 cases of COVID coming in, do you think such a facility, which is the biggest in the region, can support such a facility? No. My co-panelist, Dr. Amwakohene, talked about, and I think some of the people you interviewed were like, oh, you saw people on TV at the stadium and all that. Look at how many of us in Ghana has been vaccinated. From the Ghana Health Service site, they write 1,270 something, 1.27 something million. But even that one is made up of 860 something thousand that has had 2 shots, and then the 400 and something thousand at least have had 1 shot. You see, if you don't vaccinate, is it about 40, 50, or 70% of your population, you can't achieve herd immunity. The Western countries, they have done it, and still they are struggling. If you take, even granted that we've had 1.2 million of our population, and we estimate our population to be about 30 million, I don't think that is even 20% of our population, okay, being vaccinated. So what we should be talking about now is about compliance. That is our only saving grace, okay? Look at the COVID vaccine politics. We are not getting the vaccines. They tell you we will be getting it in 2 months, in 6 months. As Dr. Mwakohene said, I was in the States. I am not an American, but you can walk to, they have walk-in facilities. And it doesn't matter whether you are an American, whether you pay taxes to the United States government, okay, you can walk in and have the vaccine done, because they think if you are not giving the vaccine, the chances of you getting it, okay, they see you as a human being and not as a foreigner or as an American. So they have it, and they are even pleading with their citizens to go for it. A state like Ohio, okay, had to resort to raffles, begging people to go, and you stand a chance of winning $1 million if you are vaccinated. In Africa and in Ghana, we are struggling to even get 1 million doses of the vaccines. Forget about the cost people are putting on that, people trying to cash in and all that, but we are even struggling. So we should be emphasizing on compliance. But what do we see? The politicians are making our work difficult. You or him, Teria mentioned the funerals that are going on. And I don't know, it seems it's only in Ashanti region where we have the big funerals. I mean, the politicians, relatives passing, and we have the big funerals. So you can count the number of big funerals we have had. And that is giving that idea that is gone. Health workers, I mean, those leading the fight, coming to tell the populace that these are our challenges. And you have a doctor who is responsible for the Ghana Health Service behaving like he's a politician. And honestly, I don't know whether he's a politician or he's a health expert. But it's high time we let people know that, look, COVID-19 is real. We don't have the vaccines yet, okay? And the only way to protect ourselves is to insist on the COVID-19 safety protocols.
Doc, I'm happy you talk about the behavior of politicians, and also it raises the question of law enforcement, whether there are others who are above the law, and whether even the laws that we've passed in recent times to deal with COVID, whether we're really making use of it or whether it's helping to address the situation. But Dr. Mwakohene, in the immediate short, medium to long term, what should the country be doing right now?
I think right now it's clear that any country that is not doing well with the vaccinations, it's behind. I mean, I think that's part of the reason why people are fatigued about all the protocols, albeit we're not pushing that, we're not really educating our folks the significance of following these protocols. I shall tell you this, you have countries whose GDP don't come anywhere near Ghana and are making very significant investments in ensuring that citizenship or citizens of the country are vaccinated. And we're sitting in Ghana, a very pretty rich country relative to other countries. And we've been told many times stories after vaccines coming in, albeit heavily subsidized. I think you have to begin to think about the fact that you can never place money on any human life. And you don't wait to shut your economy down, because the ramifications of having to shut your economy down, feeding people on the street, you can't even quantify that monetary-wise. So it's important that you make the investment necessary to purchase vaccines to vaccinate your people. COVID is here. COVID is real. I've dealt with it. I've had it myself. It's important to know that until you are able to vaccinate your people, there's no way you're going to be able to get around it. And government, I do believe, in my honest opinion, have to really set up in terms of ensuring that we get vaccines and vaccinate our people. It's really appalling for a country, a blessed country like Ghana, that we have less than 1% of our population vaccinated. And yet the stories never stops coming. It's just, oh, we're going to get vaccines today, tomorrow, a month, 2. That cannot be right. Something is wrong. And the right people have to be put in place to ensure that we don't keep beating the same drum, and that we actually put solutions on the table so that the ordinary Ghanaian, not you, not me, but the ordinary poor Ghanaian can have some kind of safety net.
So the surest way is vaccine, vaccine, and vaccine. I'm grateful, gentlemen, for this thought-provoking conversation. Dr. Parkway Sibeidu is Ashanti Regional Chair for the Ghana Medical Association. Dr. Samuel Kojo-Amoakohene, he's an anesthesiologist, a COVID-19 ICU team leader at ACHN Health Network Connecticut, and co-founder and president of the Global Partnership Halidin LLC. Thank you so much for joining us. Ohime Teria, if you're still on, tell me, do you have any updates of this crunch meeting by health officials in the Ashanti region?
Yes, Aisha, it is not only for the health officials in the region, but I must say the Director General of Ghana Health Services, Dr. Abuaje, is leading a team of the officials to look at how best they can draw up a strategy to bring down the COVID-19 cases in the country and also on bird flu as well. Currently, the meeting is ongoing, but when we try to peep in to get some information, we're told because it's a closed-door meeting, they will not allow media to also get in, but probably we can have the opportunity to speak to the authorities tomorrow. So I must say, yes, the meeting is still ongoing and it's happening at the hotel at Funesa in the Ejuso municipality, Aisha.
Ohime Teria is a member of our health desk. He's our man there. He's monitoring events for us. We promise to bring you updates in our subsequent bulletin. Let's take with the Ashanti region, because Asantehene Otumfuo Setsu II wants the African continent to chart a new path to development in a post-COVID-19 world. He predicted a post-pandemic world would do away with dependency, hence the need for a self-reliant approach to survival. He made the remarks at the Millennium Excellence Awards at the Menchia Palace in Kumasi.
According to Asantehene, COVID-19 and climate change have threatened the development of the African continent. He therefore expects governments and citizenry to brace up for the new order the pandemic leaves behind.
Someone has to open the eyes and minds of the people of Africa to the reality that in the post-COVID world, we are on our own and we swim or sink on our own stream. This new reality has no room for any dependency syndrome, and governments and citizens alike must wake up to the imperative need to chart new paths, embrace new thinking, must have the fresh courage to acknowledge our common good and have the courage to work together for its realization.
The Asantehene acknowledged COVID-19 has had mild impact on the continent, but he is unhappy partisan politics have further delayed the development of the continent. He wants Ghana to chart a different path, especially as leadership of both executive and legislative arms of government are led by persons from opposing parties.
It begins with the two mighty figures, unfortunately the speaker is not here, who we honor today. For the first time in our history, we have leaders from opposing parties leading the executive and legislature. Many see this as a natural prescription for chaos and ineffectual governance. I see it as an opportunity for statesmanship, for rational interchange of ideas.
President Akufo-Addo, in responding to Asantehene's call for unity in developing the country, said there is synergy between the executive and legislature despite difference in party leadership.
My government was passed by the parliament without too much controversy. The budget of the first term of my second administration was also passed by the parliament. These are the two key legislative interventions that go towards the formation of the government, and both of those were done in a very good spirit, and I thank the Speaker very much for contributing to this occurrence and this eventuality. It has meant that the difficulties that people felt I would have in being able to get important matters through this Parliament have not in fact materialized, and it is because of the spirit of cooperation that I've received from the Speaker.
The 2020 prestigious Millennium Excellence Awards was in celebration of African and international achievers. A coveted Gold Coast Award was conferred on President Akufo-Addo for his free senior high school policy and other interventions to change the lives of people. The Millennium Excellence Awards is held every 5 years to celebrate individuals and organizations who have had positive impact on the African society. Many individuals from diverse fields were honored at the occasion, including investigative journalist Manasseh Azure Awini. For Joy News, Nana Ojima, Kumasi.
From one pandemic to another, the people of Ebuaka Wurenkere in the Trimanwa Biejat North District of Ashanti region are stricken with panic as the only link bridge to the community is on the verge of collapse. According to Assembly member for the area, Kofi Opoku, about 20 lives have been swept away by floods in the past 4 years due to the poor nature of the bridge. He calls on authorities to reconstruct the bridge to avoid any more casualties in this wet season. Joy News' camera technician Kofi Asare has been interacting with residents of the area as they highlight their plight.
This taxi cab was caught in the floods. It took the courage of 5 strong men to rescue the driver, 4 passengers, and the vehicle from drowning. Floods like this have claimed about 20 lives in the past year. Joseph Afrani shares his ordeal when his son drowned on the bridge.
University, national service. To free national service, never no I started to. The Hunian said, Omuhuni said, Nuyabiba, Tinuan never bore more, a domoque, and the part 5, Meme Banon quantity free Mama Canina.
Residents say children are the most vulnerable as they find it difficult to cross the bridge to school. Some say they are badly frightened whenever they see the clouds gathering since torrential rains have claimed many lives and destroyed properties in the region.
But the market will fear and fear, and fear watch it. Bromako Job fear so quabana, Bessie, and family mamma, and so top pet. The whole night will be a little bit metro, will back on school just our hand dropping. Not lack of financial short distance will walk away ye. Your financial and your fire at the number fee. Me bawe, me quite sorry, mammy baker. But Tnaha man about not one and sudden so nature. Ten Swanny dear air fire ma, air fire cronum, air fire. Yeah, what city ye?
The assembly member for the Buakwan Century Electoral Area, Kofi Opoku, said authorities have turned a deaf ear to this plea. He threatens to hold a massive demonstration against the government if their plights are not heeded to.
Whenever it rains and cars is passing through this bridge, before you say Jack, the car will go down to the bridge. Whenever someone passes through this bridge, before you could say Jack, you see the person drowning. We are giving them 2 weeks to give us the part of our national cake. The 2 weeks is going to be demonstration. We are going to block this road. We will make sure that no one passes through this bridge.
District Chief Executive Michael Ewukwamwa responded to the plight of the constituents.
We are aware of the challenge that that particular bridge presents. I can count as many as 5 or 6 people who have lost their lives as a result of the collapse of that particular bridge. So it's a concern to all of us. But fortunately, through the instrumentality of the MP and then regional minister, we've managed to get a facility under the route. So we are very hopeful that by the close of this year, we would have had a very good story to tell.
Kofi Asare's report, read to you.
Let's stay in our communities because Chief of Mradaho, a suburb of Senya Breko in the central region, Nenyi Edubate, has appealed to the government and NGOs to come to their aid by creating jobs for the people of Senya Breko and also reduce child trafficking in the community. According to him, child trafficking in Senya Breko is alarming and it's caused by too much poverty on the side of parents due to lack of jobs in the community. Nenye Edubate called on the government and civil society groups and the security agencies to also help the chiefs to fight against child trafficking since it is a major challenge to them.
Senyabreku is a fishing community with a population of over 20,000. But due to the high poverty rate in the community, majority of the fisher folks sell children to Yeji. Nenyi Edubate revealed this when 42 unemployed people graduated from the free skill training such as bees making, organized Edubate revealed this when 42 unemployed parents in Senyabreku graduated from the free skill training such as bees making, batik, tie, and dye, organized by the Engage Now Africa and United Way Ghana.
Woman traffic na ewo krom ha no nkwala omunkwa adwuma nkwala omunkwa school.
Human trafficking has become very rampant, and the children who are not schooling especially are at risk of falling prey. We plead with them to help enable children not schooling and those who have financial difficulties to complete their schooling.
NGO ne nyaka ka ho ina no ye be hom mboa se na omba beso ye awofo asese na be ya nkwala no so betumi akọ school.
Meanwhile, Country Director of Engage Now Africa, Cecilia Amankwa, appealed to the beneficiaries to take the skills they've acquired and make good use of it to be able to alleviate their family from poverty and to end child trafficking in Senyabreku.
They should put the skills that they have acquired to use. They should make sure that they are able to go out there, do the product, sell it in their local market, take care of their children and their home, and make sure that their children are never given out to people that they think can take care of their children, so that their children will not be trafficked.
The beneficiaries also pledged to make good use of the skills they've acquired.
Beekeeping, I've learned how to be a beekeeper, and it's very good. As a pastor, I can use it to support myself and become self-reliant. I therefore ask others to come and participate in a training to also become self-reliant.
They have trained us on how to make pastries like meat pie, cakes, and donuts. I believe this will help us so we can take care of our children. That way, they will not be trafficked.
Child trafficking be an income.
We're still live on the Pulse. When we return from this break, we're talking Visit Volta. You may be aware that over the weekend it happened big in the Volta region. Shortly on the Pulse. Welcome back to the Pulse. It has been described as a tourism hub of Ghana with various varieties of tourist attractions to boast of. From the food to tourist destinations, the region is ripe for investments in agribusiness, ecotourism, and ICT. But has the Volta region story been told enough? As part of selling Volta, the Volta Regional Coordinating Council, the Association of Ghana Industries, and the Volta Development Fund, the Planning Committee have created a platform to showcase the pride and beauty of the region, dubbed the Volta Fair. Already, the hashtag Visit Volta Experience Ghana has been trending all weekend since the appointment of renowned media practitioners, including our very own Emefa Apau, Kafui Day, Bernard Avle, Jifa Gbehobampo, among a host of others. We'll see and hear all about the experience, but let's bring in the man in charge of the Ghana Tourism Authority for Volta and Oti region, Alexander Kwame Nketia. He joins us via Zoom with more. Mr. Kwame Nketia, I'm grateful for your time. First, let's talk about why, as a Northerner, I should visit the Volta region.
Thank you very much, and good afternoon to your listeners and watchers. I think that Volta has everything it takes. I've been in the North before. and I'm here. So I know what I'm talking about. And we've always indicated that Volta is a microcosm of Ghana. It has virtually everything, every attraction, every cultural trait that you want here. So if you're a northerner, you want to come here, all I'll say is that come and see the manifestation of our country here.
So what are some of the key sites and attractions worth exploring and investing in?
Thank you. Apart from our culture, our festivals, we have a lot of natural resources here. We can talk about Tafi Atome, can talk about Afajato, Mount Afaja, you can talk about Amejope, you can talk about Billy Waterfalls, Tagu Falls. Amejope also has coming up a canopy walkway. We have Mount Gemi, we have Fort Presenstein, we have Atoko Slave Market. We have some very beautiful resorts along the waterfronts in the Volta region. There are so many of them, I can't mention all. And if you look behind me, you can see something that displays most of the attractions we have in the region. So there are so many of them, so many of them.
Let's talk about, but you didn't talk about the festivals, because at least I know about the Hogba Chochozan. Which others?
Yeah, Hogba Chochozan is there. We have the Gomabozan, which is the Kente festival. So that is also there. And we have the Yam Festival, also celebrated here. So at least these are three key ones I can mention for you. And they are very, very popular, strong festivals.
Let's talk about the Volta Fair. I know it's happening this November. Tell us more about this Volta Fair.
The Volta Fair was last held in 2019, but we couldn't continue because of the COVID situation last year. So this year, the Volta Regional Coordinating Council, under the chairmanship of the leadership of the regional minister, has tasked that we should try and organize it this year again. So it's going to take place between 15th November and 28th November this year. And we are urging all and sundry, both sons and daughters of the region, as well as all interested individuals who want to see the opportunities available in the region, to come and partner us to make this event a success.
So when I say visit Volta, what usually is the response?
Experience Ghana.
Experience
and
Ghana.
We say this because, like I said earlier, when you visit Volta, you see everything about Ghana and therefore experience Ghana.
Okay, well, experience Ghana indeed. But are you replicating same in other regions? Because myself, Tamale Beyonce. So if you're not going to Tamale, I don't know why.
There's a lot across the country. Every region, in fact, Ghana is so endowed. That's what I can say. Ghana is so endowed with so many things. All we need is to set our priorities right and develop and take advantage of them. But I'm talking about Volta, so it's Volta. I'm inviting all my colleagues in the north to visit me here in Volta.
Alexander Kwame Nketia, he's with the Ghana Tourism Authority for Volta NOT region, and he's been telling us why we should visit the Volta. We're still live on the pulse. We're taking a break. When we return, we'll bring you updates from the sports world. Time now for sports, and Accra Hearts of Oaks. The Masters are certainly the champions of the Ghana Premier League after an 11-year wait. One player who played an instrumental role in the club's triumph is Salifu Ibrahim, and the talented midfielder has been speaking to Joy Sports' George Ado Jr.
This is good for Accra Hearts of Oak. It's Salifu Ibrahim running down the line, sends in the cross with the left shot into the net. He goes. His unfavorite right foot, and Salifu Ibrahim breaks.
Accra Hearts of Oak winning a Ghana Premier League. Feeling not saying Nyamasa.
Feeling good because because 11 years Hearts of Oak in the league and good.
Yeah. Not just say one call for now when you're mobile or touching money at the end of my friend flow the idea.
Yeah, support us to be afraid, person be afraid. By leaking inquiry, because I'm more so afraid. Be afraid, I'm more about.
That's right. I mean, what's the one that I say? Season started at 11 wonders near the end. What's the one that I say? Which never winning Ghana Premier League at the end of the season?
No, that be my man's just time I'm switching. Say time I'm a bahas and I'm saying, I'm composition one in the jam now. As the Intimate League because Intimate League a big achievement. I'm a Salif Ibrahim.
But the saying that who bahas
moving the things to be needed much. By me share team like about one like in the future. So and I'm join us folk because number the Madimachi Kotoko as good.
Ladies and gentlemen,
by many manager decided to say person about has in a bit more one.
Wow. Now we do has now then of course I net bomb 1 or 2 be but what catch me we do has now then the course.
But you say we do us call Campo Street. We could do about around there 10:30 to 11. We call 19 and we call down we see me BMS acquired me back to the court of net or come fine because any pre and the like daddy do manage so far me bra on money in the kind because on me call down in Jeffers a very good guy they was here meeting can make me can as my
Wow. Because who joining Accra has to go, you know. Now starting your man, one check. I said there will be a Wabo Accra has to go all these years. I don't know managing this because you say I go for fee smaller clubs or more big club. I check Accra and sana, fire and start. But fire and the open happen to us.
One thing, Eddie can really ask them and go home. And I remember, like, I don't know actually this year, because with that, we need to know, like, the oppressive achievement, any players, relationship very good. So until I feel free, I'm at the old meet my day, AP. There's a man meet me, I've got two as folk system and interim.
Now, Uba has made himself war 11 wonders. Now, go focus say, oh, Salif, you're bobo. Say 11 wonders guy, you're bobo. But Uba has no. We share media. We share the media. No, social media. No, for no. Can't want them no. Who compare to now? Saying.
Yeah, because Chagana maybe you are this one better. Better by now. As an phone cancer, but Osha has to go blanket on the team city. So, and you'll be Kakra, we be a man for whom you see the one that's not me odo because one is winning 5 man of the match is no easy. As folk very marine trewa, but as folk platform no song. If you are seeing as folk or supporters, Jack Sound down to also wow. Hey, Charlie. A person of the as a folk, I'm one because I'm on social media and be a course of America.
You match would do camp now who could be social media now who send for the type would now feeling saying I often say how do you take that?
Sometimes everyone I say because I say would be a meeting, be a Facebook, be a nothing, be Instagram, be a minimum down. And I feeling good because sometimes football, bonus and we say, and I like motivating the and general so far.
Now, just say, my men or brothers or family, how are they coping with this whole thing? How are they coping?
Yeah, money I did because day in day out, I'm framing, I'm framing. Charlie, so now my tell me them I'm fan. I'm also appreciate. And always be almost some of them by boss damage. Teach me cool for so always be able to frame one bus so them by both damage.
Yanka season ho yanka season ho say we join the Accra Heartsburg yanka games no game be na ufano game be na you say na difficult pa game be na the most difficult game for your hearts
a game against any bitch because when be maybe in an answer to go far win or sabichi more na has to a pele gaje and that must born 3 points no then easy because okay be team supporters they are like more defeat or be team one and play difficult now okay only go my team a team win like say defend the easy at all it's a much difficult but I try to be a much more win. It's a much difficult man, but it's a much difficult man.
Wow. Now, match Bena who enjoy pa match I will shout and say match with it. A serious match for me. Match I will enjoy pa then match me.
Match guys I mean enjoy me say like but yeah you against any king facer. I was crazy. Yeah, I'm both game and I cause I'm a feel the boss for my enjoy game, you know. Because if you are good to the family so by like now like I'm feeling proud. Many
now right, it is our game so match that we need just now the more idea cost of teammates
it's simply beautiful. Teammates they always be like say we say you know that free banner capital like playing football team like always be from like some visa Charlie hard Charlie and see one of my strong push forward with my DHC so always be like motivate me so Jomukas as I'm always be a down man I mean match like them so instead of the understand that team like teammate for
now we share a has the Olympics game no so game na a hot game pal now more has more one na mo saying that game.
Oh, no, hot game, but no, much like not difficult because one day book, one day book, say is he can share now overtake like football society, but then you should have difficult games.
It's a match ben I'm Boria na afe mo say league in this year match ben
match in there because you call the team on that 3 points because the Kunya 3 points on able to about just 5 matches at once because near class firstly starting Kunya some more 3 points in the league it push it Caribbean for league the profile that 3 points in is like one be
Tina my bomb plans of yours say yes find be amamo
because they target is na but 90 some match in the Olympics board because target is class post the gym has bomb points in at once
it is our one day hamopa across
because Obona gas posted and Olympics you on a track ground and I also a boy home games now I target so
okay good now Yanka I Kotoko game here say that was your first game against Kotoko I mean in your first game against Kotoko as in say the chairman but say Hearts of Oak our boy against Kotoko and me first super clash before game not then I will game time after game baba
as Kotoko has supporters for match and high social media for like
hype no
yeah hype no but it's a game like who play like as I was cycling I say because a game like games you're going games Diana like it's so simple because space room so be a person training Bobre So like just confidence, like we just have confidence now over game, you know. Protocol or a big team or a big team by match SOP and boss a match no person would say who boss a match because and now it be like US maybe the match and I boss a match I am feeling all high.
Yeah, now feeling all high. Phobia spirits were high, pa.
Yeah, because Ghana I want to say you know a classic some who boss a match na play be on opportunity boss a match na so feel now enjoy game.
Anyway, na movie ni na just say na dey cloud nine. Now what can I just say when you are then pa na ye wo sa na wo ye dey na then na ye wo sa na to nyuma na say
me always be like sometimes maybe funny because obi only there like camp like always be if you say me manage because me person me body me person me do always be entertaining crowd.
Okay, beautiful. Now maybe bisa say who share season na mo buy and I'm say when some we do na mo say mo just around the time I buy that time na mo coach some we do so join here because the guys are unveiling no now when some we do na mo take time mo unveil the two of you now when you coach some we do no we saying relationship no coach no what kind of saying how would you describe the coach no?
Yeah we a good coach and I feel we coach always be like watching them back like we free because football is be a footballer we a coach now like when you play in terms of relationship in a good one like you be a person you be like young person I say we need about one team we coach like always be an official in PS3 so like we could watching the press banning channel after the game we are there once we are there so like we are the name we catch up so and OTT in a equal so like boys will be a we fit like we good coach like they have no I'm feeling
na aya ne celebration ya dia na ya mu bisa na say na coach na celebration no na ma saso na say celebration say aya mu bi
like yana or like boy sana it means like coach we on finna do any agro so or passion my jumana
yes
because we share with the coach now like motivate you know when you are like like the team should go like video money so I just say like a jumano like when minister like a jumano person or so they no one can see a place so because always be or person watching VB so even coach now or just touch like you say now we play now we park this way so like my feeling there and we see and go Ghana have back which is back say place I should go partner like was celebrity champion so
it's a motivating account
motivating because I see what you say coach is serious away and you my own friend
very good very good now fans no now who see Accra has fans no who am I saying because
fans in the meeting come out and fans in the don't want me my like the football career and I guess I mean who be that say the fans you see you know like Charlie you go point fans
Charlie nti sa enyum na moto no hwe gu yen so hwe sa enyum no moto a I think feeling pa na basa no
say like team bia or anyone like we feel like I say as folk and I say enyum ba kwa like to a place you know like a motivate so a motivate was it and you go on my to like I say like my craba also
a very strong midfield but she players some good midfield na netin nam ha swa ka Salif nam ha futu nam ha and Sabochi nam ha Uma Manaf Tabha. Wosha, Mubet me have a 64 battalion for Nana.
Nina Empire because that Rankakra. Give it my possible because said now has a dealing gacha. Nakopon don't let me. I break his recording. Yeah, bomb by a cran. I go on give it to Nina Empire and a hard work. One person I go on fair on.
Okay, good. Now, Cecilia, they say, what started you doing CAF Champions League? The one answer over Chenkaka. And I about what you because I'm about CAF.
This year, if you have no winning, the enemy first target, I see the country once, and the one, the upon after. So until after the match, so until upon after the cup.
Okay, good. Now, Mami Bissau, one or two things in your company. If you see our here, play our mama's reply, mine.
Yeah, because I got Obe Campua, like between Cassie, like we part of Maurice and I see the Maurice. So,
it's a munya, but
listen, what I want to say, oh, like I did media pay, like they are a place to see, you know, like, yeah, so, Jama like Obi Feli will be so, and now they are like media pay, grace, and so.
Yeah. Na say Accra they can move Accra the Janiben pan when you have been oh
the other was a nearby like okay the doctor in the Accra by the preparable
don't go net is super banku na banku there I am
banku there tell roommate or no chuli banku na
now woody banku ai
the two on the chair
one of the fastest.
Patrick
Razak. Yeah. Now rank it fast ranking. Who ain't fan? Ranking ain't fan. Okay. One of the best dancer. One of Sapa best dancer.
For me, Benjamin Futi.
Aputu. Osapa o. Na Mujama leader. Na Mujama leader why?
I say yes German.
Yes, one age.
Yeah, go for strong one is German.
Oh sir. Bumudi one first.
First Bemensa. Keeper.
Okay, then keeper. Okay.
Yeah, Netty.
Okay.
Yeah, coach Hamza.
Yeah. Wow. Okay. Now, team no one your suffer. Team no one your suffer. One no bomba ba.
Keeper na Bemensa.
Okay. Bemensa na attack.
Yeah. No, Bemensa.
Okay. Oh no, bomba ba. Okay. Now, I am ko campa. One no sorry first. I'm a friend Reverend Bemensa.
I see Reverend because I want to say.
Okay, now I'm a campa. One no sorry first. One not sorry first. Who bet you no sorry?
Because it me because
I saw sorry last. Not just I sorry last.
That me sorry last by. Say be because the time saying be a idia. Yeah, boss say for na kishia ba me from name we say be a say.
Okay. Good. All right. Inti you better was say any more time when you spend there with her me Ghana for nyina. Yeah, wish you the very best of luck. Now we want to see a lot from you because why are the season way there? Abo season epa. Now I have coach Phil. Actually, 11 on the coach of Phil.
Didn't come up. Advice, advice.
Okay. But could be to me who said what's we a homecoming be? I think say one last TV we a homecoming be. Say we'll go back to your roots. Not feeling it to say.
Yeah. Not easy because be share me, family be share me. Actually, so see, so maybe team like it will match now family share of pounds. Sometimes it's me, how many G.
That was sports with George Adojenia, and that's how we part company on the Pulse this afternoon. Log on to myjoyonline.com for more of the developing stories, and their stories, a lot of them that you will see. One of them, I was desperate, frustrated, and helpless. Health Minister defends failure to seek parliamentary approval for vaccine contract. More of that on myjoyonline.com. I've indeed enjoyed my almost 2 hours stay with you. My name is Aisha Ibrahim. Enjoy the rest of our day.